Healthwise, brought to you by Winona Health. Healthy starts here.
Get down!
If someone were having a heart attack, would you be able to help? Many of us probably wouldn't. But this week in Healthwise, Winona Health emergency physician Dr. John Gallagher offers some life-saving information.
Timing is critical, and getting the public involved in starting care prior to the arrival of EMS is absolutely paramount. If you look at the numbers, this becomes obvious. The brain gets itself into trouble anytime it doesn't have good blood flow for over 2 minutes, which is a pretty short period of time. It takes on average about 1 minute to process a 911 call, which is actually pretty good nationwide. And then here in town, we have anywhere from a 3 to 5 minute response time. So if that tells you that I can get an ambulance to you within 4 to 6 minutes, but your brain only has 2 before it's in trouble, it becomes obvious why the community needs to be involved.
What can the community do to help?
Well, there's really 2 things that we've found that help people in sudden cardiac arrest. The first one is good old-fashioned CPR. And we've learned most recently that you don't have to do mouth-to-mouth or rescue breaths. Just doing the chest compressions is enough. And then the second thing is using an AED.
And what is the AED?
So an AED stands for Automatic External Defibrillator, and that is a device that can assess the patient's heart rhythm and determine whether or not a shock is appropriate. Everybody's seen on TV that we shock people with heart attacks, and that on TV at least it brings them back every time, and while we don't have their numbers in real life, the principle is the same. So it's a small device. You may have seen them at airports, in campus buildings, even in some businesses. There are small cases that can be brought directly to the patient. They have 2 large stickers with wires coming off of them, and then either 1 or 2 easy-to-read buttons. You don't need any specific training to use them. It walks you through it with an automatic voice, and it'll tell you exactly what to do.
So how does an AED help?
So in the setting where the person's cardiac arrest is from the arrhythmia that we talked about, an analysis from the AED and then a shock can reset the heart, get rid of that irregular rhythm, and bring back normal blood flow.
And now the $50,000 question, does it work, and does it always work?
It certainly doesn't always work, but the use of an AED can double a patient's chance of survival.
As a novice, no first aid training, how do I tell whether or not the person needs CPR or they need the help of the AED?
Right, a fantastic question, and one of the reasons why people don't help somebody in need is because they don't know what to do. The easiest way to think of it is anyone who's unconscious and not breathing normally, right? If you are having a sudden cardiac arrest, the body oftentimes continues to try to breathe, but it won't be normal. The other way to think about it is giving CPR to somebody who doesn't need it causes almost no harm, but keeping it from somebody who needs it could be the difference between life and death. So it's always better, if there's any doubt in your mind, to start doing CPR and connect an AED.
So someone is definitely struggling and they need some sort of help. What happens if I hook up the AED and administer that shock, but they don't need it?
Won't hurt them at all. So the way the machine works is once you connect it to a patient and turn it on, it will assess the patient's condition. And if they don't need a shock, it won't give one. I could connect one to you right now and it wouldn't do anything because it sees that your heart is working correctly.
How do we locate them, and what if somebody just wants to become more familiar with it? So if there is an emergency, they don't have that, let's say, paralyzing fear, but they're not afraid to go and use the AED.
Sure, absolutely. And that's what we're hoping that the community does. The Winona Area Ambulance has put together a program called Project Helping Hearts, which is something that can get the community connected to the locations of AEDs, training on how to do CPR, and basically teach them how to save the life if they're near somebody who has a sudden cardiac arrest. They can get in touch with us by either contacting Winona Area Ambulance Service. You can talk with any of our community paramedics that are out and about around town, or you can even search for us on Facebook by searching Project Helping Hearts.
All right, very good. Thank you, Dr. Gallagher,
Thank
for
you.
your time today.
Happy to be here.